Welcome to this presentation on diabetes mellitus, tailored for medical students and healthcare professionals. We'll break down this complex condition into digestible sections, covering its definition, symptoms, diagnosis, types, and treatments. By the end, you'll have a deeper understanding that you can apply in clinical practice. Let's dive in. About diabetes mellitus, diabetes mellitus, or DM, is a long-term condition where blood sugar levels stay too high. This happens because the body either doesn't make enough insulin or doesn't use it properly. Insulin helps glucose enter cells via the GLUT4 transporter, primarily found in muscle and fat tissues. Without proper insulin function, sugar builds up in the blood. Some of this excess sugar is converted into sorbitol by the enzyme aldose reductase, which is abundant in tissues like nerves, eyes, and kidneys. Sorbitol accumulation in these areas contributes to complications such as neuropathy, retinopathy, and nephropathy. Over time, these issues affect various organs. The main symptoms of diabetes include urinating a lot, called polyuria, which happens when high blood sugar forces the kidneys to get rid of extra sugar. This can lead to dehydration and a constant feeling of thirst, known as polydipsia. In type 1 diabetes, people may lose weight unintentionally because their body breaks down muscle and fat to use as energy when it can't use sugar properly. They may also feel very hungry, called polyphagia, because their cells are starving for energy. Other symptoms include blurred vision from high sugar levels affecting the eye lens, feeling tired all the time because sugar isn't being used well, and frequent infections like yeast infections or urinary tract infections. These infections happen because high sugar levels make it easier for bacteria and fungi to grow, and the immune system doesn't work as well. Diabetes may also present with nonspecific symptoms such as constant tiredness, which happens because the body isn't able to use sugar for energy efficiently. Blurry vision can occur due to the lens swelling from high sugar levels. Skin infections, especially fungal ones, are common because high sugar supports the growth of fungi and the immune system doesn't function as well. Poor wound healing happens because elevated sugar damages small blood vessels, reducing oxygen supply to tissues. Tingling or numbness in the hands or feet, called peripheral neuropathy, results from long-term nerve damage caused by high blood sugar. How is diabetes diagnosed? The primary tests include fasting plasma glucose, where levels above 126 milligrams per deciliter, milligrams per liter, indicate diabetes. Another test, the oral glucose tolerance test, OGTT, involves drinking a solution containing 75 grams of glucose after fasting. Blood sugar is then measured 2 hours later, and levels above 200 milligrams still are confirmed diabetes. Hemoglobin A1C levels, reflecting the average blood sugar over the past 3 months, are also diagnostic if above 6.5%. In addition to the primary diagnostic tests, other tests provide valuable information in diabetes management. C-peptide levels help differentiate between type 1 and type 2 diabetes, as low levels indicate a lack of insulin production seen in type 1. Autoantibody testing, like GAD antibodies, confirms autoimmune diabetes. Continuous glucose monitoring, CGM, gives real-time glucose trends and is especially useful in patients with frequent hypoglycemia or type 1 diabetes. It is essential to differentiate diabetes from conditions with similar symptoms. For example, diabetes insipidus, unrelated to glucose, causes excessive thirst and urination due to problems with the antidiuretic hormone. Stress-induced hyperglycemia, which is usually temporary, can mimic diabetes during illnesses like infections or trauma. Other conditions such as Cushing's syndrome or hyperthyroidism may have overlapping symptoms. Each of these conditions will be discussed in detail in separate lessons to provide a comprehensive understanding. Diabetes can cause acute complications if not managed properly. Diabetic ketoacidosis, DKA, occurs mostly in type 1 diabetes due to a lack of insulin, leading to high ketone levels in the blood. Symptoms include nausea, vomiting, abdominal pain, and fruity-smelling breath. Hyperosmolar hyperglycemic state, HHS, is more common in older adults with type 2 diabetes and involves severe dehydration and confusion due to extremely high blood sugar levels. Hypoglycemia, or low blood sugar, can happen due to excess insulin, skipped meals, or intense exercise. It causes symptoms like sweating, shakiness, and confusion, and needs immediate treatment with glucose. Over time, diabetes can lead to chronic complications. Microvascular complications include retinopathy, where high blood sugar damages the retina, nephropathy, which involves kidney damage, and neuropathy, causing nerve pain or numbness. Macrovascular complications include heart disease and peripheral artery disease, which can lead to amputations. Managing blood sugar, blood pressure, and cholesterol levels is key to preventing these outcomes. Diabetes is not a single disease but includes various types. Type 1 diabetes is an autoimmune condition where the body's immune system destroys insulin-producing cells in the pancreas. It often presents with sudden symptoms like weight loss, thirst, and frequent urination. Type 2 diabetes, the most common form, develops gradually due to insulin resistance and a relative lack of insulin production. Latent autoimmune diabetes in adults, LADA, is a slow-progressing form of type 1 diabetes, often misdiagnosed as type 2, as it initially responds to oral medications. Monogenic diabetes, including MODY, is caused by single-gene mutations and usually appears at a young age. Secondary diabetes can result from pancreatic diseases, medications, or hormonal disorders like Cushing's syndrome. Each type requires tailored management. Managing diabetes starts with lifestyle changes. Dietary adjustments, such as carbohydrate counting, focusing on low glycemic index foods, and achieving a healthy weight are foundational. Regular physical activity, including aerobic and resistance exercises, significantly improves glucose control. Behavioral support and education also play a vital role in long-term management. Pharmacological treatments vary by diabetes type. For type 1 diabetes, insulin therapy is essential. Basal insulin covers daily needs, while rapid-acting insulin manages meal-related glucose spikes. For type 2 diabetes, first-line treatments include metformin, with second-line options like GLP-1 receptor agonists or SGLT2 inhibitors, tailored to patient comorbidities such as cardiovascular or kidney disease. Monitoring is critical in diabetes care. Patients are advised to check blood glucose levels frequently, especially if using insulin. Glycated hemoglobin tests are done every 3 to 6 months to assess long-term control. Uncontrolled diabetes can lead to complications, including retinopathy, nephropathy, and neuropathy. Early detection and intervention can prevent these outcomes. Diabetes mellitus is a complex disorder requiring individualized care. Advances in therapies and technologies offer hope for better management and outcomes. Thank you for joining this journey to understanding diabetes, and I hope this session has been enlightening.